Most patients think improving a smile automatically means veneers. Cosmetic dentist Dr. Pamela Vranis weighs in on smile enhancement options from simple whitening all the way to full veneers. Stay with us until the end when she reveals one of cosmetic dentistry's best kept secrets for enhancing a smile. It's something most patients barely know exists.
3D printed veneers are becoming a thing. Same with 3D crowns, of course. And I still like the traditional lab made veneers because they can be thinner and stronger and more transparent, less opaque, less chiclet, and more natural.
Back in the day, I remember my mom talking about her crowns, and she said, I hope they never come off because they had to shave all of my teeth down like Dracula. Is that
Ugh.
still the thing?
It is. It is. Seeing your teeth when they're crown prepped, so shaved down and contoured for crowns, is very scary. So, yeah, you do not want to hand the mirror to the patient after the crown preps are done. That is a visual that they will never get out of their mind. But great point in that crowns, you have to shave down more teeth, more tooth structure. So, versus a veneer. A veneer, you're only really shaving down and contouring the front side versus a crown, you're shaving down and contouring 360 degrees around that tooth. So it's like a crown in the back of the mouth, but in this case, it's in the front, and it does look really scary without a crown on. Just looking at your teeth without the crown on. So, but yes, we have to contour more for a crown. So, but the advantage is that it has a lot more retention because it has 360-degree retention and hold. It's very rarely is a front crown going to pop off. Very rarely is a front crown going to crack and fracture. Again, unless a dentist is making them so thin, which we really don't do or see. Crowns, you can pretty much guarantee that a front crown is going to stay for a lifetime.
Now, now I'm recalling because I'm thinking of risks. When my son was very, very young, his dentist put, I think it was a crown and it was on a baby tooth. I don't remember why. And then it popped off at some point and it was all rotten in there. Is that a risk of crowns or was that something else that I should not be worried about?
Well, baby teeth are their own thing. And I don't work with a lot of baby teeth, but because they are supposed to fall out a lot of times to make room for the adult teeth, a lot of times those baby teeth kind of do their own thing. They resorb, the roots resorb. They they act differently than adult teeth do. But in truth, underneath crowns, it is very common to, after decades or years of having crowns, it is common for bacteria and decay to seep in under that crown and to start rotting the tooth. And that's really unfortunate because it's pretty difficult for us as dentists to capture that quickly. We sometimes don't see that decay under a crown until it's either too late or it's progressed into being a decent sized cavity under that crown. And most times we just replace the crown, we clean out the decay, and all is good. But there are times that that decay is really sneaky, and it's not it's not showing itself that easily because a whole crown is on top, and it's really hard to see on X-rays. So it can happen where we can lose the tooth because there is decay under there that wasn't seen. Now, for the front of the mouth, usually we see that a little easier because that decay is just more visible. We're able to have really clear vision in those front teeth versus a back tooth. So we can really see all the way around that tooth. And we are just less conservative with front teeth because those front teeth are smaller. If we see any little sign that something is happening under that crown or veneer margin, we're replacing it, or we're really highly encouraging and educating our patients to explain to them that we're seeing something at the edge and we have a feeling that it's seeping in under, and the quicker we act on it, the better. The better chance we have to just take off the current crown or veneer and replace it and still have really healthy, good tooth structure underneath.
In what situations would you recommend crowns versus veneers if somebody's really looking for a structural change?
For a structural change, if the teeth are healthy and there's no real decay and cavity, I would definitely say just do a veneer. It's more conservative. You're shaving off less tooth. It's a great option for that aesthetic change that people might want. So less, yeah, way less shaving down. So the patient keeps a lot more of their teeth, of their tooth. And on top of that, they can change an entire look with veneers. So it's an easy choice. Would recommend a crown if the teeth are heavily decayed, meaning there are cavities under there, so the tooth is therefore more compromised. And so definitely then you would want a crown supporting that tooth rather than just a facing, a veneer.
Now, as we prepared for this interview a while ago, you shared a third option, which I feel like it's cosmetic dentistry's like best kept secret. I was not even aware of this. Can you share? Beauty Seekers, we so appreciate you being part of our community. If you'd like to have more educational aesthetic content like the one we're doing today with Dr. Pamela Vranis, please subscribe. Stay with us. You're not going to want to miss when Dr. Vranis shares the smile enhancement option that some consider to be one of dentistry's best kept secrets. You shared a third option, which I feel like it's cosmetic dentistry's like best kept secret. Can you share?
A composite veneer is a chairside veneer. It can also be called a chairside veneer. It's very conservative in the sense that, and it's different than a lab made veneer. A lab made veneer, you have to wait for the lab time or 3D printing, which takes time, versus a chairside composite veneer is built up chairside. The patient is there and you're just adding on composite material to the teeth or the tooth. And it's a great way to have a lot of input from the patient real time. So if the patient doesn't like the shade, you can change it. If the patient doesn't like the shape, you can change it right there and then. It's a longer appointment, but it's very heavily interactive with the patient and it's modifiable. Most importantly, it's they tend to be reversible. So if we don't want to keep them for whatever reason, we can theoretically just bust them off. Versus a lab made veneer, most times there is preparation involved, meaning there is drilling and shaving and contouring done, and that is therefore irreversible. So a chairside veneer can be very convenient for the patient where they want more control and more say in the result. And you can do smaller things and smaller defects changes or larger big effects where the whole composite veneer runs through the entirety of the tooth and it's a less invasive.
Okay. So how do you deal with the shading issue with chairside?
You technique, and shade matching. So you get really creative with using different shades of composite and matching it to the patient and just doing a gradient. So you can be just as accurate with the shade just by using different colored composite.
And can you explain composite? Because I get veneer, you put something on, I get crown, you put it over composite. What is that?
Composite is filling material. It's resin material that we use for nowadays almost exclusively for any kind of filling. So anyone who gets a filling in the back of their mouth, they're getting composite filling material done and placed in there. So it's very strong, it's very durable. And we because it fills teeth and it's used so heavily in dentistry and in the mouth, we started using it in the front in anterior teeth, and with really good and high quality composite material plus good technique and good polishing technique in particular, you can make a tooth look beautiful with composite.
Okay. And so what are the risks then with the composite?
Risks with composite versus a lab made veneer, for instance, is that it's a bit more prone to staining. So, because the material has to be so highly polished, if it's not or it falls a little short, it can be a more porous than a lab made veneer. So, because of that porosity, it can then retain a little bit of stain. So it's not uncommon after maybe 5, 10 years of having a composite veneer that it just has to get redone or touched up, finished. So that's not uncommon. But again, it's not a big deal to do because you're starting off with from such a conservative place. But that's the biggest risk. And also just making sure that as that veneer, as that chairside composite veneer gets flushed up against that gum line, that's really thinned out and polished well so that it doesn't irritate the gum. However, that risk does happen with lab made veneers as well. That is a risk for lab made veneers as well. Anything that touches the gum has to be really thin and perfect so that it doesn't irritate the gum, even at a low grade level. So yeah, those are the risks. Other than that, it might be slightly more prone to chipping, but not really. You're kind of just as careful whether you have a composite veneer or a lab made veneer. A dentist will always tell the patient, just be really careful with what you're biting into. That's something that you find with both types of veneers.
Beauty Seekers, we are so pleased to be bringing you this educational content on smile enhancement from Dr. Pamela Vranis. If you're finding value, please subscribe. It'll give us the right signals for us to continue to create more educational content for you.
So, okay, as I said before, I had two braces twice, and in kind of the clear aligners twice, but we couldn't move these two teeth out because of the bone. What do you think a crown or a veneer or a composite veneer would be? What would you recommend or questions you would ask?
For the canines?
Yeah, they're right behind. There's like 1, 2, 3, 4 teeth. And they go
Okay,
again.
right behind. That's a great question. And I actually just got that question today. So depending the uh on what you're trying to do, because really a combination of things could be desired here. If it's more of a movement to, for instance, a lot of times our teeth behind our canines start to narrow in a little bit. A great option for some could be to first do ortho, first do aligners, taking it back to our aligners, to flare those teeth out a little bit and to buy us some room so that we're not adding such a clunky crown and such a thick crown. So sometimes the best outcomes come from a little bit of a few treatment options. ortho can really help get us there if the movement, if the difference, if that space is bigger. So starting with ortho could be great, and then finishing it off with either a veneer or a crown. Again, just depending on if that tooth is a virgin tooth and doesn't have any bacteria and decay on it, I would stick to a veneer. Keep it conservative. You can always go from a veneer to a crown, but you can't go from a crown to a veneer. So staying conservative would be my best option, as long as, of course, it fits with the bite. There's a lot of factors. The mouth is so small, but there are truly so many factors to consider. But a little bit of ortho plus then prosthesis, so either a veneer or a crown would be my recommended choice.
Is there anything that you'd like to share with the BDC community in terms of, if it's someone like me and we're looking just to enhance our smile, any words of wisdom?
Absolutely. First and foremost, just have a good relationship with your dentist. I think that's really important. And that's a lot of feedback that I get from my patients, that you want patients to feel comfortable to ask you anything. You want someone who is going to tell you the truth and not oversell you on treatment, and also educate you, give you the facts, the dental facts. I feel like I say that a lot to my patients, that you make up your mind. I will facilitate that, but the first and foremost, like, what you need to know are the treatment options and the facts, the pros and cons to all those options. So I think having that open dialogue with your dentist is the most important, because all your questions will come out. And it also gives the dentist an opportunity to get to know the patient, because the more the patient talks, the more the dentist understands the true concern and the true source of what the patient is desiring. So having that relationship, it's an intimate space, it's an intimate field. It's very based on trust. It's very much based on trust. And it goes both ways.
Well, oh my goodness. I know we just scratched the surface today on different techniques for enhancing a smile, and you've taken us through a lot. And thank you so much for sharing this best kept secret. These composite veneers, chairside, is just an amazing, approach that I wasn't completely aware of. And I'm glad I am, because now I'm going to go to my dentist and walk in and say, Dr. Vranis gave me some information.
Absolutely. My pleasure.
Yes. Thank you so much, Dr. Vranis. You are a gift to the BDC community. Thank you for your time.
Thank you.